Welcome to today's video where we'll be exploring a rare and complex eye condition, microphthalmia-associated glaucoma. This condition involves the co-occurrence of two distinct but related eye abnormalities. Join us as we delve into the causes, symptoms, diagnosis, and management of this challenging disorder. Microphthalmia-associated glaucoma, as the name suggests, arises from a combination of factors. Microphthalmia, meaning small eye, disrupts the normal development of the eye during gestation. This developmental anomaly often leads to malformations in the eye's drainage structures, predisposing the individual to glaucoma. Genetic mutations play a significant role, with several genes implicated in both microphthalmia and glaucoma development. These mutations can affect the signaling pathways crucial for eye development, leading to structural abnormalities. The pathophysiology of microphthalmia-associated glaucoma involves a cascade of events triggered by the abnormal eye development. The small size of the eye often leads to an underdeveloped or malformed anterior chamber angle, the area responsible for draining aqueous humor, the fluid within the eye. This impaired drainage increases intraocular pressure, or IOP, which damages the optic nerve, the vital link between the eye and the brain. Over time, this optic nerve damage leads to progressive vision loss, the hallmark of glaucoma. The severity of glaucoma depends on the extent of the angle abnormality and the level of IOP elevation. Microphthalmia-associated glaucoma is a relatively rare condition. Precise epidemiological data is limited, but it's estimated to affect a small percentage of individuals with microphthalmia. The prevalence varies depending on geographic location and genetic background. It's often identified in early childhood and can be associated with other systemic conditions or syndromes that involve developmental abnormalities. The signs and symptoms of microphthalmia-associated glaucoma can vary depending on the age of onset and the severity of the condition. In infants and young children, parents or caregivers might notice an unusually small eye, clouding of the cornea at the clear front part of the eye, excessive tearing, light sensitivity, or an enlarged eye known as ophthalmos. Older children or adults may experience progressive vision loss, eye pain, headaches, or halos around lights. Because young children often cannot articulate their symptoms, early detection by a pediatric ophthalmologist is crucial. Diagnosing microphthalmia-associated glaucoma involves a comprehensive eye examination by an ophthalmologist. This includes measuring intraocular pressure tonometry, examining the anterior chamber angles gonioscopy, assessing the optic nerve ophthalmoscopy, and evaluating the visual field perimetry, especially in older children and adults. Imaging techniques, such as ultrasound biomicroscopy (UBM) and optical coherence tomography (OCT), can provide detailed images of the eye's internal structures, helping to identify angle abnormalities and assess optic nerve damage. Genetic testing may also be recommended to identify specific gene mutations associated with the condition. While there isn't a widely accepted classification system specifically for microphthalmia-associated glaucoma, it's often categorized based on the severity of microphthalmia, the type of angle abnormality, and the age of onset of glaucoma. Some cases may be associated with specific genetic syndromes, further defining the classification. It's important to remember that each patient's condition is unique, requiring individualized management. The treatment of microphthalmia-associated glaucoma aims to lower intraocular pressure and prevent further optic nerve damage. Initial management often involves topical eye drops that reduce aqueous humor production or increase its outflow. If medications are insufficient, surgical intervention may be necessary. Surgical options include goniotomy, trabeculotomy, trabeculectomy, and glaucoma drainage devices and tube shunts. In some cases, cyclophotocoagulation, a procedure that reduces aqueous humor production by targeting the ciliary body, may be considered. The choice of treatment depends on the specific characteristics of the case and the response to initial therapies. Close monitoring and follow-up are essential to manage the condition effectively. Currently, there are no proven methods to prevent microphthalmia-associated glaucoma, as it is often caused by genetic factors or developmental abnormalities that occur early in gestation. Genetic counseling may be beneficial for families with a history of microphthalmia or related conditions. Early prenatal care and avoiding exposure to known teratogens, substances that can cause birth defects during pregnancy, are generally recommended for all pregnancies. The prognosis for microphthalmia-associated glaucoma varies depending on the severity of the condition, the age of diagnosis, and the effectiveness of treatment. Early diagnosis and aggressive management can help to preserve vision and prevent further vision loss. However, even with treatment, some individuals may experience progressive vision impairment. Recent research focuses on identifying new genes associated with microphthalmia and glaucoma, as well as developing more effective therapies to lower intraocular pressure and protect the optic nerve. Gene therapy and regenerative medicine approaches are also being explored as potential future treatments for this complex condition.